stroke alert patient. Blood pressure of 190/100.
It can happen in seconds with no warning, but doctors say the biggest risk for having a hemorrhagic stroke can be prevented.
Basically, there are two types of strokes. One is what we call an ischemic stroke, which is where there's not enough blood circulation to part of the brain. And then you can become paralyzed or lose your speech because the part of the brain that's getting that blood supply is impaired. And that constitutes about 80 to 85% of all strokes.
But a hemorrhagic stroke is caused by bleeding in the brain. While it's not as common, doctors say it can be more serious.
15% of all strokes are bleeds. So it's not rare, but they can be very dangerous too, depending on the location and the size. It's slightly more dangerous in terms of survival than a regular stroke, but the deficits can be the same in both.
Hemorrhagic strokes are typically associated with high blood pressure. They can happen suddenly, causing paralysis, a terrible headache, and loss of speech.
High cholesterol is a risk factor. Stress can be a risk factor, but by and large, hypertension is the main risk factor.
Patients with high blood pressure need to increase their physical activity and modify their diet.
We know now that a third to 50% of patients don't take their medication, so that's why we have these problems.
While hemorrhagic strokes typically happen in advanced age, doctors say they can happen to anyone with uncontrolled high blood pressure, which is why it's important to monitor your blood pressure and make necessary changes to your lifestyle. For Lee Health, I'm Lindsay Fry.